Welcome, everyone. My name is Jess Posner. My pronouns are she and they, and I am the Director of Virtual Programming for the YMCA of Central New York. I am a white woman in her 30s with brown hair, wearing glasses and a black shirt with white letters that read solidarity, equity, justice, empathy, anti-racism, and we wear black. The We Wear Black themed digital background behind me features a collage of African American ancestors, leaders, and visionaries over a solid Black background. I am honored to welcome you to today's virtual Lunch and Learn, Structural Racism and Health Disparities in Syracuse, New York, with Brittany Taylor, American Heart Association of Central New York. It is presented as part of our We Wear Black 2023 programming in honor of Black History Month. To learn more, visit ymcaofcentralnewyork.org or visit us on social media. Today's conversation will explore the history and intersection of structural racism and its influence on health outcomes in Syracuse, New York. Our speaker will discuss lasting effects of redlining, bias, and how a system rigged against those living on the south side of Syracuse, New York, continues to impact health and well-being. Our speaker today, Brittany Taylor, is the current Community Impact Director of the American Heart Association for Central New York and a lifelong Syracuse, New York resident. She has over 10 years working in the healthcare industry, understanding how policy directly impacts our opportunities, access, and delivery for health-related services. The American Heart Association and American Stroke Association is the nation's oldest, largest voluntary organization devoted to fighting cardiovascular diseases and stroke. Founded by 6 cardiologists in 1924, this organization now includes more than 22.5 million volunteers and supporters working tirelessly to eliminate these diseases. They fund innovative research, fight for stronger public health policies, and provide life-saving tools and information to save and improve lives. The American Heart Association and American Stroke Association's mission is to be a relentless force for a world of longer, healthier lives. And without further ado, I would love to turn the virtual platform over to you, Brittany. Thank you so much for joining us today.
Thank you. Thank you so much for inviting me today. I would like to thank the YMCA for presenting this opportunity for us to learn more about our community here in Syracuse and how our history has affected our health and how it continues to affect our health. I'm going to go ahead and share my presentation. Okay. So as Jess mentioned, the goal of the American Heart Association is to be a relentless force for longer and healthier lives. And, our 5 pillars that we work on is really working on systematic changes, changing systems, changing policy so that we have lasting effect. It's really that idea of you can feed a man a fish for today, or you can teach them how to fish and teach them how to eat for the rest of their lives. And that's really what we try to do in terms of spreading our mission and creating change in the community. As the Community Impact Director, that is my role. I do cover the Central New York region, so Syracuse is my home, but I do cover 14 counties. I go all the way north to Watertown and then all the way south to Binghamton, so I cover that center portion. So when it comes to the areas in which the American Heart Association focus, a lot of times we're known for our work in hypertension and most recently in CPR. But I wanted to provide a visual of all of the areas in which we continue to make an impact in. So we have a focus on women's health, addressing the community need, ending e-cigarette and tobacco use, high blood pressure, nutrition security, and mental well-being. And above all else is making sure that we help to influence a system that is equitable for all, where everyone has access to care, research, and the quality of care through advocacy and then through social impact. So these are all of the pillars that we work on in the community to make for a better community. So I wanted to start with giving a context around the health in Syracuse, and then we'll talk more about the history and how that continues to make an impact. So as I mentioned, I do cover the greater Syracuse area, which includes Cayuga, Cortland, and Oswego counties. And if you can look on this graph, you can see that the majority of the population is white. We have a small amount here of Black, Asian Americans, and then multi-race. And then the population is pretty balanced in terms of age demographic. However, when you look at the rates of poverty, Syracuse has, or within Onondaga County, we have a 14.63 percentage of those living in poverty. And what we know is that when people are living in poverty, they have less access to healthy foods, to healthcare, to behavioral health services, and this can really impact the longevity of their lives. Which, when you think about it, in Syracuse, just going 1 mile can change the life expectancy from 15 years. So for those living on the South Side, they have the lowest life expectancy in Central New York. And over the course of time, we've been subjected to different biases that have impacted the availability of services, which decreases our life expectancy. But, the question could be, how did we get here? In 1950, the Syracuse Urban Renewal Plan was designed in the area between State Street and Syracuse University. Over 27 blocks were targeted, impacting 75% of Black population. The Urban Renewal Project was completed between the 50s and 60s to take which made way for Interstate 81. So the Syracuse Urban Renewal Project was slated to it was supposed to improve access for Central New York. So having the highway was supposed to allow more businesses and more people to be able to travel through Syracuse or to Syracuse in a better way. The problem with that was that there was no consideration. Well, there was consideration of where it would go, but it was a bias. So what they did was, this area was known as the 15th Ward in Syracuse. The 15th Ward was the Black community. It was a thriving community. There were their own businesses. They had their own meat markets and tailors and pharmacists. And this is where they were kind of segregated into this part of the city, but there was such a sense of unity there. So it was home to the city's Black community, but also a large Jewish community and the immigrant population. This was what they called the nerve center. In this community, they had a sense of unity. They had their homes and their businesses. There were community gardens and churches. So although it was segregated, they functioned very well in that capacity for the most part. And it was a thriving community. So when they decided to come through Syracuse with I-81, they went directly through this neighborhood and knocked it down. That affected 75% of all Black-owned businesses in Syracuse, New York. Thank you to the Onondaga Historical Association, where I did a lot of my research and grabbed a lot of these pictures. This is a picture of a Black-owned grocery store called Williams Bros that was on State Street at the time. This is an example of one of the businesses that was ruined during I-81. It's a little bit of an older picture, but the idea is there that the Black-owned businesses were affected by I-81 coming through. And I grabbed some quotes from a researcher during this time. This was a true sense of losing the community when they came through with 81. There was churches, there were things like the Dunbar Center, which still stands, but it provided more access. So the Dunbar Center is a Black organization here in Syracuse where they have like social clubs and they have opportunities for education and access to other like healthy foods and health education. And with bringing through 81, it knocked all of this down. there was a sense of community outside of that that also did not survive. They say, that when kids were playing on the streets, everyone know who each other were. If you did something wrong, by the time your parents' foot hit the doorstep, the neighbor was letting them know and getting you back in line. And unfortunately, this was lost. Here's another picture of the 15th Ward before it was knocked down. So Robert Searing is a curator at the Onondaga Historical Association. And what he talks about is that, the idea of that really tight community, and the Black residents had no choice where they could live. And this was largely due to the idea of redlining. Redlining was a restrictive process that was created by those in power that only allowed, that legally created the idea that people could only live in a certain amount of space. And when people tried to move, they were denied housing loans and other opportunities. Landlords did not allow them to move into those areas. And the landlords that also lived in this, or that provided housing in this area, were a lot of times absentee. And so this actually made a stronger argument for 81 to come through, because they were able to say, hey, well, these are aging houses. These houses are not built well. They're in poor shape. So this will be the best part, because we can beautify the city by getting rid of these houses. Unfortunately, when they did that, there was no contribution from the Black community. And there were no plans for where these individuals will live, other than sending them to the South Side. But it didn't include new housing opportunities or places for people to go. It really just ruined the community and didn't give them an opportunity to have a say-so in what their community would look like and what would be the effects of that. So what is redlining? Redlining is a process by which banks and other institutions refuse to offer mortgages, or they provide worse rates for customers in certain areas. It's one of the clearest examples of systematic racism in the history of the United States. And although there were the passage of the Fair Housing Act in 1968, which denounced the systematic racism and said that they had to provide housing opportunities to all, it still continues in various forms today, whether that's through discrimination in mortgage practices, or the discriminations in credit histories, things like that. All of those contribute to the continued redlining in our community. And how does redlining affect health? Well, what we know about these populations is that when you intentionally create these communities that are devoid of resources, then there's higher levels of air pollution, and it also increases the opportunities for social determinants of health. So when people don't have access to great transportation, or when they don't have access to behavioral health centers, medical centers, then of course, if you're not visiting the doctor, then that definitely impacts the health in your community. So what are the differences between health disparities and health inequities? So a lot of times when we have these conversations and we'll hear these terms, they can be used interchangeably, or we hear them used interchangeably, but that doesn't truly reflect their definitions. A health disparity is the difference in a health status. So whether that is a cancer rate, or maybe that is the rate in which someone has diabetes, that is a health disparity. But in health inequity is the systematic or avoidable, the unfair or the unjust. So it's not just the rate of breast cancer, it's the rate of the mortality of breast cancer for Black women versus white women. So that's the difference between Black women not receiving care because they're looked over or they're not treated in a way where those things would be discovered in a routine visit, versus the actual disparity of breast cancer in the community. The redlining also creates what we call food deserts. So food deserts don't necessarily mean that there is no food in the area. It just means that there's a void in access to healthy foods in grocery stores. Sometimes this can be thrown off by other stores that may accept EBT. But what we know is that in Syracuse, the South Side is definitely lacking in the grocery store. So if you take a look in the South Side of Syracuse, the closest grocery stores to the 13205 area, you do have Price Right, which is more located on the southwest side of the city. And then you have Green Hills, which is located deep in the valley. But that area on South Salina Street, that starts maybe around downtown and goes all the way down to the valley, there's no access to healthy fruits and vegetables. You do have a lot of corner stores, but a lot of times they don't provide access to those things. And so when you're in a community and you're eating a lot of non-perishable foods, this is why a lot of times you'll see arguments of not wanting certain stores like Dollar Trees or Family Dollars or Dollar Generals in certain areas, because they do sell food and they do accept SNAP and WIC. It can kind of throw off our food desert maps because there isn't access to food. But if we look at the availability of healthy foods, that's where we really start to see the difference. And if someone only has access to non-perishable foods, they're eating the ramen noodles and the Chef Boyardees, we see increased rates of obesity, hypertension, cholesterol, because they're just not eating the greatest foods to sustain their bodies. So some of those results, like we said, there's increased rates of hypertension, high cholesterol, and obesity because of the lack of access to foods. If you're only eating those highly processed foods, it doesn't give your body a great opportunity to reset and really predisposes you to these foods. So with when you are intentionally not providing access in these areas, when there isn't an opportunity for grocery stores to come in, or you have forced a population of people to live in this area, you most certainly are subjecting them to a lower quality of life. And metabolic syndrome is one of the conditions when you have the 5 risk factors. So when you have high blood pressure, high cholesterol, as well as a large abdomen and high blood pressure, that leads you to metabolic syndrome, which increases your risk for other cardiovascular events such as heart attacks, strokes, and cardiac arrest. And the way that we think that you can combat this is through having better access to Life Essential 8. So Life Essential 8 is created by the American Heart Association that really just shares what are the different opportunities for you to improve your health. And these are the 8 opportunities. So by ending your use of tobacco, getting quality sleep, having a well-balanced diet, having access to physical activity, understanding high blood pressure, high cholesterol, and diabetes, and also your weight management. So where are we today? We have an opportunity to really repair some of the effects of I-81 in the infrastructure. The I-81 infrastructure has reached its lifespan, and if you've been paying attention to the news in the last couple of years, there's been a lot of conversation around what to do with I-81 now that it has reached the end of its life. the idea that they have chosen to go with is the community grid, which means the I-81 will come down. But in that, there's now housing projects that are around there, and it will also affect the continued access to the hospital. And, we have to figure out where those people are going to live. So we're at a critical point in history where we have the choice to affect history. We know that in the past that the decisions that were made were not those that were made for the community, in support of the community, in consideration of the community. And now we have an opportunity to have influence in how that reaches us now, or how that affects those that are living there now. I'm sorry. So further ways to engage in the community and learning more about this is first by engaging in tomorrow's neighborhoods today. Each sector of the city has their own meeting, and you can visit their website and see exactly when your meeting is. And just being involved in understanding what's happening in your community, what opportunities are happening in your community. Those meetings are really helpful to understand the new policies, new rules and regulations. There's also some opportunities for grants sometimes for the community, and just to understand what's happening at a local level in your neighborhood. The other thing is to share the information that you learned today with at least one person, because if we understand the history and we understand how structural racism impacts our health, then we have the opportunity to encourage others to speak up and have an opportunity to really rectify some of the damage that was done in the past and start with a new future. Engage in learning more about the I-81 project and its implications on health and wellness on current residents. Get involved in the conversation. Understand, develop your own point of view and what you think is right, but be a part of the conversation so that community voices can be heard. What we do know is that when we work together, there's more of an opportunity for us to make changes in the community versus just one small subset of the community. Redlining hurt the Black community. Redlining destroyed family structures. It destroyed a sense of community. And we have an opportunity to go back now and make sure that that doesn't happen to the current families that are living there now. There's all sorts of implications around even the health of taking I-81 down, because as those viaducts come down, there'll be tons of dust and debris. There's noise pollution, that will affect the health of the residents. The residents in this area already have higher instances of asthma and hearing loss due to the vibrations and the dust that come from the highway. And we have an opportunity to really speak up and help those individuals to advocate for a better health standard and a better way to live. The other thing is just engaging in better managing your own health, knowing your blood pressure, having opportunities where you're checking your blood pressure, understanding diabetes and cholesterol, understanding your family history, getting out and exercising, or making sure that you get in those 30 minutes of physical activity each day. Better taking care of yourself will encourage others around you to do the same. In Syracuse and in the New York region, we do have the local Check It Challenge, and it's asking you to commit to checking your blood pressure at least twice per month. So we have, it's a 4-month opportunity, and in February, we had the opportunity to learn more about high blood pressure. The recordings are posted on the website, so you can go back and listen to that. March will have a focus on nutrition. April is on physical activity. And the Heart Challenge is actually being held at the SRC Arena at the Southwest YMCA on April 16th. So that's an opportunity. And then May is learning about mental health and stroke and how those two things are connected. So the Check It Challenge really asks you, what's the least that you can do to change into healthier habits and understand how the health of your body and we ask that you take your blood pressure at least twice per month. If you sign up for the Check It Challenge at heart.org/checkitnewyork, you will receive emails that will give you healthy opportunities or education about your health, as well as access to the monthly webinar that's hosted. So thank you so much for listening to the presentation about structural racism and how that impacts our health. Jess, did you have any questions?
Yeah, thank you so much, Brittany. I just wanted to thank you for giving us this really comprehensive introduction, both to the work that you do with the American Heart Association and then also to some of the largest looming legacies of institutional and structural racism here in Syracuse, mainly the I-81 project and sort of like the legacy that it has left since then. So I just wanted to thank you on behalf of the YMCA of Central New York for bringing that forward for us and for kind of laying that all out and beginning to give us an understanding of how these things are interconnected and how the work that we do in healthcare, including those of us at the Y, can really work to support not only, what we currently have, but also the future that we see ahead of us with this like multi-billion-dollar project, right?
Yes, absolutely.
So I just wanted to kind of like thank you for planting that seed, for all of us here today and beginning to give us that education. I see that we do have a hand raised from our friend Heather, but before I call on Heather, I would love to just ask a little bit about you actually and how you got started in your advocacy, both with, sort of like local advocacy around these issues, but then also maybe your work with the American Heart Association.
Yeah, well, as you mentioned, I am a lifelong resident of Syracuse. I attended Roberts K-8. I went to Corcoran for high school and is in the first graduating class of the International Baccalaureate program. And I would say even then, being a part of the IB program really at least helped me to understand that I had a voice. So one thing that was great about that program was that it wasn't multiple choice. Everything you had to explain. And so being able to find my voice and be able to advocate for myself was something that I learned right here in Syracuse. I then went on to complete my bachelor's at Nazareth College in Rochester, where I studied social science with minors in political science, law, and business. And through that, I remember my senior year, we read a book called How to End Poverty. And at the time, I really wanted to go into higher ed and work with students. But that book really taught me something and really touched me in a different way, because it says, to end poverty, you really have to have a healthy population. And how do you have a healthy population if you have so many different access and barrier points for people to get access to the care that they need? And that really changed the direction of my life. And when I graduated, I worked for an insurance carrier. And from there, I worked for Liberty Resources as a director. I started in case management, ended up in a director position. And that was by far my introduction into advocacy work. I started a program called the Sankofa Wellness and Resource Center that was located on the South Side. And in order to get that grant, we did a lot of research. And, it's different when you hear about a food desert, but it's different when you experience it. And when I had to go and sit and be like, oh, what am I having for lunch today? And be like, oh, well, I can go to the corner store and get some fried chicken, or I can go to Burger King that's a little far away and get some more fried foods. And just being in an area where there was truly just no access. And then the pandemic hit, and that really flipped everything upside down. And that really gave me my drive to want to advocate for others and provide access, because if you don't have access to your basic necessities, then you can't plan for a life. And that's how you get trapped in the poverty cycle. So my experiences in that role led me to really want to work on a systematic level, where I can work with clinical providers, I can work with community-based organizations and even the local government to bring light to these issues and provide sustainable change. It was great that I was able to do food shares for 6 months every 2 weeks, but how do we get it to a point that we can get a grocery store back in the Valley in Syracuse? Or how do we get to a point where people have better access to transportation, or they understand their health and they're engaging with their providers, or they feel heard when they go to the doctors? And just understanding, being a case manager and walking in those shoes with my clients really gave me a heart and a passion for this work.
Thank you so much for sharing that, Brittany. Heather, would you like to join us? Unmute and join us, Heather?
Yes, hi. Sorry. Hi, Brittany. Hi, Jess. I just had a quick question. I may have missed it. First of all, I love this topic. I was so excited when Jess sent it out that it was happening, because it's such an important piece of not only history, but where the why as a community-based organization fits into the space of health and wellness, healthcare, health innovation, et cetera. And so thank you for sharing some of that information. I just wanted to ask, you talked a little bit about gentrification, which I guess, it is a gift and a curse, because you do want to make things beautiful and give the community what they deserve. But at the same time, then people get displaced. And so with the 81 project, whenever that does happen, and I know there's a lot of backstory behind the delay and all of that, and mainly being inconvenient for those in the suburbs, right? That you're cutting off a path. I mean, let's just call a spade a spade. But my question is, have you heard, and I may have missed it, so if you said it, I apologize. Have you heard with this 81 project where people may be displaced? Like what parts, what areas they may be displaced, or are they planning on building, new things, new housing around there so people don't actually have to leave their community? What have you heard about that?
So, like you said, the project can be quite controversial. But what I have heard is that the idea, the last time when they built 81, they knocked things down and didn't have a plan. The idea this time is that they'll have a 1-to-1 match for affordable housing, so that as people become displaced, they'll be moved into a better apartment or a better place that has updated. So right now, the area where 81 is, it goes in between, it basically is the barrier between upstate Syracuse University and the rest of the city. And right around that area are a lot of housing projects. And how they determine to just knock those buildings down is because the buildings have also reached their own age. And so it would make more sense to knock them down and build new housing opportunities that have updated amenities and updated things. And there's ideas around having childcare centers and education centers in these areas now. And that all makes really great sense. However, we already don't have enough affordable housing. So even if you're doing a 1-to-1 match and you have more opportunities for what they call the mixed income housing, there's still fears that the mixed income housing will eventually price these individuals out of being able to live there. And we're still at a deficit. So even if you do a 1-to-1 match, we're still in a place where we don't have enough affordable housing for those living in Syracuse.
Yeah, and you made also a good point around redlining, and then when you take redlining and gentrification, the people who actually do own homes in those areas, once they gentrify and new people move in, then the taxes, right? Then the taxes go up, and then that prices people who have been there for years and years and years and actually owned a home, which again, I think most people don't realize that the number one indicator, right, for health equity is your financial income, which has everything to do with, racial housing segregation back then and even now. So it's interesting how it all ties together. And if you're not in the weeds, like some people, you wouldn't recognize that they're really interrelated and not interdependent of one another. So yeah, thank you for that. I just was curious what they planned on doing, because I know that is going to be a big problem. And is that related to the Blueprint 15 project?
Yes, Blueprint 15 is an organization that seeks to make sure that everyone's voice is heard and uplifted, that the community has a piece of the pie and sort of determining what happens to them and what happens to the community. But it's very complicated. It's very complicated. And I know that at this point, they're starting with the rerouting before it comes to the housing aspect. And that'll give them a little bit more time. So they have to, if they're going to knock 81 down, then they have to kind of refigure 481. So they're starting with that part of the project first, but there's so many lawsuits that it just keeps getting stalled. But definitely we have to learn from our history. We have to learn from the mistakes that we made, and make sure that the individuals living in that area and that will be affected by it continue to have that there's continued dialogue to make sure that their voices are uplifted during this process.
Yeah, thank you for that. And in case anybody doesn't know, the Y is at the table and on the committees for the Blueprint 15 project. So that's very exciting. Well, thank you, Brittany.
You're welcome.
Well, thanks so much, Heather, and also Brittany for more of that information and for some more insight also into that conversation. So thank you for that. We do have a comment in the chat. And I'm gonna, Janice, with your permission, I'm gonna sort of like modify it a little bit, just because you brought up Blueprint 15, and I know that there are some other organizations in the area, and it sounds like there's, some real interest around sort of learning more and getting more involved with the I-81 conversation. I know you're not a specialist of I-81, however, as an advocate, are there other groups or voices that you would recommend that folks who might be on the call or watching this on YouTube look to for more information or to get more involved? I know you said that today's Neighborhoods Tomorrow, the TNT meetings, and then we've also now got Blueprint 15. Are there others that you think that we should have on our radar?
A lot of times too is just paying attention to the local politicians and those like State of the City and going to the open meetings to understand what's going on in the community. I know this is it's off, but it's related. We have to pay attention to more elections than just the presidential elections. Our local elections are really important. Understanding who's in the community, who's working for your community, what their stance is on things like I-81. That has a huge implications. When we talk about systematic racism, systematic biases, there's a system behind it. And if we can't infiltrate the system, if we aren't a part of the conversation about what rules are being made, then we have no opportunity to have a voice in that change. So yes, joining, finding those conversations when they're happening, definitely understanding who your local legislature is and what their stance is on it. And joining those Tomorrow Neighborhoods today are really my greatest suggestion in becoming an advocate and understanding what's happening in our city.
Thanks so much, Brittany. I have another question, but I'd also like to invite anyone else on the call who has questions or comments to raise your hand, and you can unmute or pop your question in the chat. But I wanted to ask just a little bit more. When we were preparing for this, we had a really nice chat in which you were talking about how the American Heart Association really does identify institutional racism as one of, I can't remember if it was...
social determinant of health.
Social determinant of health. Sorry, I am just for everyone on the call. I've got some brain fog from COVID, so thanks for helping me out there. But I was wondering if you could talk a little bit more about how sort of like a national or even international level. Well, I guess it's American, so it's national, but how a national organization can use that kind of vision or prioritization to make impacts on a local level.
It's really important because American Heart Association as a whole is all about research. A lot of the funding that we ask for goes towards research on a national, international, and a local front. So even locally, we have like 6 or 8 current projects that we're funding where people are researching things about maternal health and paternal health and how that affects babies and things like that. But identifying and calling out that systematic racism is a social determinant of health is really crucial, because that gives an opportunity for more research to be done. It calls a thing, for lack of a better term. It's not just a term that's floating out in the universe. It's not just a buzzword. No, this is a thing that actually affects the health and wellness of those around us. So when the American Heart Association declared that as a social determinant of health, it gives more of a backbone for the research that's being done. It gives more of a validity to the research that's being done. I've been at the American Heart Association. Tomorrow will be my 1-year anniversary. But one of the things that continues to impress me is their commitment to understanding equity and how that all affects our health, and really pulling the research together for that, and really calling it out. That's really important. And I would also say that as an organization, they're committed to that. It's not just something that we read about. We have community conversations internally, and having that sort of support is really important as a Black woman.
Well, thank you so much for that. I really appreciate it. And I also appreciate you articulating how that works for the American Heart Association, because for those of us working on the inside of the Y, we also know that, one of the priorities that YUSA has identified is that of anti-racist work, and so beginning to really see how that work can make an impact on a local level, like we're seeing it today, right? Even just this conversation right now, to my knowledge, I don't know that we've ever had a public conversation, with a title like this, right? With experts in the room like this, so I wanted to thank you for making this happen on a relatively short notice, because I think it's a really beautiful beginning, honestly. And, when I look at the names of some of the people that are here in the room, both ones that I know and those that I don't know yet, it makes me really excited for how we may be able to have more of this kind of conversation in the open air here in our communities, to really take power, right, over what it is that's happening, and at the very least, our position to it, right? And, I don't know if there's anything else that you want to say to that as like a lifelong advocate, because that's something that we kind of share also, in terms of our advocacy work. And, I wanted to let everybody know too today that one of the things that made Brittany's presentation and presence today so special is not only because of her affiliation with the American Heart Association, but also because of her work as a lifelong advocate, and when you are able to kind of bring those two worlds together, which at times can be, challenging, right? But when you're able to really fuse those and bring those together, really kind of like magical things can happen. So, and not to say magical, but I'm going to say profound things, right? Because it's not magic, it's hard work, as we know. It's lots and lots of hard work.
Yeah. But I appreciate that the Y has provided this open space for conversation, because a lot of times people are afraid to touch these things. But they're really important because it really shapes how we move forward. I think that Syracuse, a lot of times people say, oh my gosh, you do so much. Why don't you move away from Syracuse? Like, you can do so much more other places, but this is home. And where else should I make improvements other than the place that I live, where my nephews and my niece grow up, that, maybe one day in the future, if I have children, that they'll grow up here too. That's really important to me. I think that we're at a critical point. I know I said this a lot of times in the presentation. We're at a critical point where we're able to change the history, change the narrative of the history of Syracuse. There's so many different opportunities with the local businesses that are coming in, that we really can shape Syracuse into be even more family friendly than what it is, for every family to feel welcome here and not just some. And I appreciate that the YMCA is open to having this dialogue and continuing to deepen their relationships with the Syracuse community, specifically the Black and Brown community, so that we can really make those changes for the next generations.
Thanks so much for that, Brittany.
Yeah.
Any final questions or comments from anyone in the audience? Well, if not, I'd just like to, wait, we got Heather again. Thanks, Heather.
Sorry, this is just one quick thing. And I think, Brittany, when you and I met virtually, I guess it feels like 2 months ago. It could have been last week. I have no idea. But anyways, when we were talking, I think I mentioned that the work that the Y is doing and you all are doing around blood pressure, self-monitoring and things of the check change. Well, I know it's not the check change control anymore, or is it? It's like it was.
Nationally, it's check change control. Locally, we call it the Check It Challenge.
Okay.
Yeah.
So I'll learn that too. I've only been here a year or two.
Yeah.
But what I will say is that the work is important because I think I mentioned to you that my uncle at 64, who passed at 64, his journey through an unhealthy, if you will, lifestyle, whether it's because he chose it or whether it was culturally, being from New Orleans area and, the love of food and cooking and all those other things, started in college from a high blood pressure reading. And you probably think to yourself like, okay, well, what if he would have done something about that high blood pressure reading at that moment and changed kind of the trajectory of where he was going? But instead, it didn't change, and he had the means to make the change, right? The knowledge to make the change, the education to make the change. But there's so many that don't, because of systemic racism, because of what's put in their communities or lack thereof, because of transportation, because of all those things. But when you look at his journey at a young age of 64, and you talk about life expectancies in some of those zip codes, when you think about it, he went from a high blood pressure reading that could have been changed, right, to pre-diabetes, to diabetes, to stroke, to becoming a double amputee, to, you know what I'm saying? And so it goes on and on, compounds, and that's from somebody that had the means to make a change. And so I always, when I think about this work, I think about, yes, there are people that have the means to make the change and they will or won't do it. But there are so many people that do not have the means to make that change. And I believe wholeheartedly that the American Heart Association and organizations like the YMCA have an obligation to be in those spaces to make it easier for people to make those changes in a positive way for better health outcomes. And so, again, I just wanted to state that because I always go back to his journey through this to the end, which, by the way, when you get into even healthcare, now we're talking about leaving this earth with $10 million in medical bills, literally. Like, that's not a made up figure. That's literally what the medical bills were coming in through a nursing home with all around care, that literally just didn't get paid. Because who has $10 million, right, to pay for care? I mean, it's outrageous, right? So it's important, the work that you're doing, and it's important that we partner, the Y partners with an organization like the American Heart Association so that we can reach more people, touch more people, and really make the changes that I believe that as CBOs we're like, we must do it, and there's an obligation to do it. So again, thank you very much for your presentation. I look forward to connecting with you, in the future, of course.
Yes, when you talk about that domino effect of health, that's one of the things that led me to the American Heart Association. I'll tell this real quick, Jess. So my cousin, his name was Jovan Works. He was 50 years old, and he had been diagnosed with high blood pressure. And he had always been active and an athlete, but he was diagnosed with high blood pressure at a young age. It is something that runs in our family. But unfortunately, he didn't always manage it the best. He didn't engage in his provider visits. He didn't take his medications. And that led to kidney disease. And his kidney disease, he ended up needing a transplant. And, we had so many different scares with his health being up and down related to that. And then finally, during COVID, he was provided a transplant and he was doing so well. He traveled for an event and he contracted COVID, and he was diagnosed on a Friday with COVID and died on Monday. And that was completely devastating to our family, because here we are thinking we've gotten past the worst of it. And I know that COVID was a thing that took him, but really the mismanagement of his health prior is what contributed to that. And whether that is lifestyle or education or understanding the importance of engaging with your healthcare providers. He is the battery pack every day of why I get up and do this work, because I lost my cousin at 50, and there's no reason that we had to do that. There's no reason that his children had to suffer that way. So, it's so important to me. It's a critical point for me. It's a passion point for me that we really work to improve the health of Syracuse, because these are our friends, these are our family, these are our mentors, these are the people that we look up to, that we're losing because of the domino effect of not taking care of your health at point one. So again, thank you, Jess. Thank you to the YMCA for providing this space, and I look forward to continuing to work together to be a relentless force for health in our community.
Well, thank you for sharing that, Brittany, and also to you, Heather, for your contributions. I wanted to, before we wrap up, I was like, there's been so much to cover today, and so personal and also so large scale, right? Like from the institutional to the personal. And I think that that's one of the things that I'm going to be leaving today with, is in terms of thinking about how do these large institutional things impact individuals, right? And also how can individuals work within those systems, which I think but you, Brittany, were speaking to so beautifully around getting involved with elections and paying attention to things. And Heather, in terms of talking about, the work that we do. And I see a comment from friend Caitlin Nye in the comments here, who is a nurse and educator at Upstate. And she asked around, and I'm going to ask Brittany and also Heather or anybody else that might be on the call that would want to chime into this, but just around the relationship between Upstate, Upstate, local affiliates of national organizations, and the role that those play in civic engagement, advocacy, and then health. So I was just wondering, Brittany, could you speak to that a little bit? And then Caitlin, I don't know if there's more that you want clarified, but maybe we can have a little bit of a conversation with our last few minutes around that.
Yeah. So as a community impact director, that's essentially what my role is to make sure that we're connecting our hospital systems, our community-based organizations in the way that's supportive of the community. So I'm tasked with really understanding what's going on in the community and assessing the community needs. But to her point, these large organizations that have the money and the resources really are responsible for engaging in a great way with the community and understanding the health of the community. And that even starts with just the development of their staff. So something that we do, I talk about working in the community and working with clinical providers, but that also is working with organizations and working with their staff and improving the health of their staff and making this information well known with them, because these are the people that are out in the community every single day, or these are the people that have influence in the community every single day, and having those personal relationships and having those conversations with those organizations. It's very important that organizations don't think about themselves and their bubble, but what influence, especially the larger ones, do they have on the health and the wellness of the city, and how are they contributing, especially in relation to what are they taking from the community? Like there should be a mutual exchange there.
Does that answer it, Caitlin? Okay.
Yeah, thank you. I feel like there's like a whole different discussion to be had about this, but I've been at Upstate for a little over a decade, and the levels of engagement, consideration, and sort of even just like geographic position of Upstate in relation to the surrounding neighborhood is super complex, not unproblematic. And as somebody who's trying to teach nurses and future nurse practitioners in that setting, it's something I've really worked hard on in my practice as an educator, but like am also, in and of the institution, and like see a whole range of what goes on. And it, it's interesting. And so I just was curious about your perspective on it, because I know,
one of our board members, Nakia Chambers, actually is at Upstate, and yes,
I love Nakia.
clap for Nakia. She works in the like office of engagement in terms of making sure that the students and the staff are aware of the issues in the community and understanding how they engage with the community and how that engagement affects overall health, right? Yeah. Like you can't treat people that you're afraid of, things like that. So yeah, it's a long conversation.
Yes. But thank you for the, smattering of it right here at the end. I appreciate it.
Thank you.
Yeah. Well, thank you, everybody, so much for all of the seeds that I think were planted today. This was a really beautiful and generous conversation. So I just really wanted to extend a deep gratitude to you, Brittany, to the American Heart Association for enabling you to do this work with us. I know the YMCA of Central New York is very grateful for your voice and the work that you are doing, and I'm going to speak, just to the ears in the room, that I think that it would be really nice for us to imagine continuing this conversation in some way. So if that's something that anyone on the call is interested in, please feel free to reach out to me, and I'm happy to be a connector. And also, of course, a thanks to Stephanie Michaels, who wasn't able to be on the call today, but who was the connector to bring Brittany to us today on occasion of We Wear Black, and just the larger conversations of how to better our community. And so I just really wanted to thank you for that foundation, for the seeds, for the water, for the sun, and for the hope, that I will say that you brought with us with this information. So thank you.
Thank you.
Yeah. And if there's any final thoughts that you have, it's yours to close us out.
Yeah, I would just say, really understanding the tapestry of your community is important. Getting to know the people around you, the issues around you, and really investing in the community is so important, because it's where we live, and we can't do anything unless we're figuring this out together and we're working together to find a solution. So I just encourage you to, have those difficult conversations, have the conversations that make you uncomfortable, because it's the only way that we're going to progress.
Well, thank you so much, Brittany. And with that,
thank you.
We'll send everybody on their way. Enjoy the rest of your day, everyone.
Yeah, bye-bye.